COVID cases continue to rise across the country, and we're seeing it here in Florida, too. There's another COVID vaccine rollout, this time targeting new variants ahead of the fall and winter months. The updated Pfizer and Moderna shots were approved by the Food and Drug Administration earlier this week and will be available as soon as today. But when it comes to who should get the shots, the federal government and Florida's top health advisors are not seeing eye to eye. Florida's Surgeon General Dr. Joseph Ladapo and Governor Ron DeSantis are warning against the booster shots for anyone under the age of 65, saying there's not enough trial data to support the safety and efficacy of the vaccines. But the CDC is recommending everyone 6 months and older get the vaccine. And with mixed messages here coming from top health officials, the decision on what to do, of course, is going to be up to you. Our Cara Duffy joins us with more on the rollout and what you need to know if you're considering getting these updated shots.
The rollout is already underway right now, so depending on where you live, you could get one of these new vaccines or booster shots as early as today. And like the previous ones, they will be offered at places like here, your local pharmacies like Walgreens and CVS, as well as doctors' offices and healthcare clinics. Now, the big question, of course, who should get these new shots and how are they compared to the first round of vaccines? We checked in with Dr. Imran Ali. He's the assistant clinical professor at the Icahn School of Medicine at Mount Sinai Hospital in New York City. He says he would strongly recommend the updated shots for anyone who is elderly, immunocompromised, or who suffers from long-haul COVID symptoms.
I want to stress that long COVID is now an issue for everybody, those who are elderly or even young. I'm seeing athletes who have lost their physical endurance because of the coronavirus. So it really, helps to prevent getting infected in the first place. You may not be as ill as requiring a hospitalization, but, the long COVID syndrome can certainly affect your quality of life going forward.
When it comes to young kids, Dr. Ali recommends talking to their pediatrician first to then help make that call. But before you go and get the shot, consider the cost. For the very first time since vaccines became available, the federal government will not be covering it. So unless you have private insurance or Medicare, Dr. Ali tells us it could cost you more than $100 for a dose. Reporting in West Palm Beach, I'm Cara Duffy, CBS 12 News.